da, da, da.
Maestro.
Just a minute. Da, 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 da. Sit. Da, 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 da. Ha! Now, what is it?
Maestro, it's been rumored, and I can see rightly so, that you've been working laboriously on your newest and most brilliant concerto.
Whatever in the scale of C gave you that idea? C, D, E, F, G. It was Hilda, wasn't it? That blabbermouth?
Not exactly.
Mildred. Zelda? Sherry? Murray? Who? Oh, I give up. Yes, I admit it. I am writing my most ingenious symphony to date.
Ingenious?
Whatever. And do you know what inspired me?
Hilda.
No, you silly. My smile. A real beauty, isn't it? Yes, I call my music Preventive Dentistry in B sharp.
It's original, to say the least.
It's fantastic, to say the least. There I was one day, looking at the mirror, wondering how I could improve my perfection. And then it came to me it wasn't my classic nose, or my soft flowing hair, or even my forgettable music. No, it was that other set of ivories in my mouth. I mean, where would I be without my teeth?
But Maestro...
Just a rich...
But Maestro...
Just a rich, brilliant genius in a world of rich, brilliant geniuses.
Why worry? Nothing's going to happen to them.
Ah, that's how much you know, you silly. Teeth are a living part of you. If not looked after, they'll be as useless as a dill piccolo. Or a dull piccolo.
But my teeth feel fine.
Now, everything is not as it seems. Take me. I seem to be a humble, likable, calm sort of a fellow. But inside, I'm a raging turmoil of fortissimos.
No.
Yes! You see, your teeth may feel fine, but could be slowly breaking up and breaking down. Instead of marking time, I work at maintaining them. I practice preventive dentistry.
Well, how about helping out some of your fans?
No autographs today. I lose more quills that way.
No, Maestro. I mean, could you tell us how to take care of our teeth so that we may emulate you, so that all will see that you are the most benevolent, the kindest, the most generous man that...
Enough already. That I should see the day when I would become a dentist. Well, where should I begin? A pill!
A pill?
Who's teaching this class?
Sorry.
Now, as I started to say, if you chew on a disclosing tablet, you can see the plaque that has been accumulating on your teeth.
Disclosing tablet? Plaque?
A disclosing tablet is a pill. This pill temporarily dyes those portions of your teeth that have plaque. Plaque, my tone-deaf friend, is an invisible coating on the teeth. When bacteria and sugar combine, they form a plaque coating, which is difficult to remove. Since you didn't see it, it may remain too long in an undisclosed place.
And the bacteria will begin to eat away at the enamel.
Now, don't put the arpeggio before the horse. When plaque builds up, it hardens into calculus at the gum line. Ta-da! Calculus builds up, and it contains more and more bacteria. Eventually, the infection, it spreads deep into the gums and into the jawbone.
Which is bad?
Like a lost chord. So, you get disclosing tablets from your dentist, or you just use food coloring to dye your teeth so you can spot the plaque. Dig? Dig. 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 A little bit too much fortissimo on my credenza.
Maestro?
No, but...
You told us how to identify the cause of dental troubles, but how do we prevent it?
What's with this we business? Is there someone out there with... Hilda! Hilda!
We, figuratively speaking.
It must be Susie. Now, she's got a figure. Well, I shall tell you how to take care of your teeth. Then you shall get your hemi-demi semiquaver out of here.
Agreed.
Agreed. Help me, please. Okay. The first and most important thing to remember and to learn for proper oral health is knowing which foods to eat and which foods to use with caution. The bones that support your teeth need lots of calcium and phosphorus. Milk, ta-da, and green leafy vegetables, ta-da, have plenty of it. And teeth are helped by chewy foods, carrots, celery, apples.
So, with the right diet, I'll receive the correct nutrition to be healthy.
From the inside. Now, what about the outside of your teeth? That correct food that you just ate. It probably left remnants between those bicuspids and those molars, yeah.
Heavens!
To Betsy! There's only one thing to do to get rid of that. We have to get into it. No, that'll never do it. That won't. No. Get it now. You got it now. Brushing is one way. Brushing. Brushing at least once a day thoroughly and effectively. That can remove plaque from accessible tooth surfaces. Just be sure to brush after the last time you eat each day so that none of that plaque goes to bed with you. Because during your sleep, the mouth is drier and the breakdown is greater. A toothbrush like this that has soft nylon bristles with rounded ends, they're the best.
And then just brush away.
No, you don't just brush away like you so glibly said. It takes skill and practice, like playing a well-tuned clavalier. Place the head of your toothbrush alongside your teeth with the bristle tips angled about 45 degrees against the gum line. Now, move the brush back and forth and back and forth with short strokes using a gentle scrubbing motion. For the front teeth, brush the inside surfaces of the upper and lower jaws by tilting the brush vertically and making up and down and up and down strokes with the front part of the brush. Any questions?
Well, yes, you said brushing was good for getting rid of plaque on accessible surfaces, but what about those hard-to-reach spaces between your teeth?
Get flossed.
I beg your pardon?
Who am I, the governor? What I meant was dental floss. Dental floss cleans between the teeth, especially at the gum margin where a toothbrush can't reach. Break off about 18 inches and wind most of it around one of your middle fingers. The other end winds around the same finger of the other hand to take up the floss as it is used. Use your thumbs and forefingers to guide the floss between your teeth. Holding the floss tightly, use a gentle sawing motion to insert the floss. Slide it into the space between the gum and the tooth until you feel resistance. Never snap the floss into position. While holding the floss tightly against the tooth, move the floss away from the gum by scraping the floss up and down against the side of the tooth. A, D, A.
Do you know about interdental devices?
No, but if you hum a few bars of it, I'll fake it. That's a little inside joke that we use on the symphony circuit.
Now, humor. Truly a man of all seasons.
Interdental devices, such as a specifically shaped toothpick and rubber tips, may be used to clean between the teeth, just under the gums.
Toothpaste?
Only with white wine.
I mean, which kind?
The Council of Dental Therapeutics of the American Dental Association has recognized that some fluoride toothpastes can help prevent dental decay. Now, let me ask you something. How do you know if you already have any type of gum disease?
I guess if I feel some pain.
Yes, feel some pain. You see? That's why I'm the maestro. I know the 7 warning signs. Do you have... Zelda. Do you have bleeding gums when you're brushing your teeth? Do you have bad breath? Are your gums soft, swollen, or tender? Is there pus from under the gum line when you press? Do you have any loose teeth? Are your gums shrinking away from your teeth? Is there any change in the way your teeth come together?
And if my answer is yes to any of those 7 symptoms, I might have gum disease.
Might? You bet your polyphony. But there's only one sure way to know. And this is an important point in preventive dentistry. Visit your dentist regularly. Your dentist can tell you if you have any disease or if you're simply not getting proper nutrition. And once plaque has been converted into hard calculus, only the dentist or dental hygienist can remove it. Your dentist can clean and examine your teeth. He spots dental problems long before they become too serious to be corrected.
But I tell you, my teeth look and feel fine.
Rejoice. But what about when you're older, sweetie? Your teeth were meant to last a lifetime with proper care. I don't know about you, but I don't want to need dentures for the rest of my life.
And this is what your concerto is all about.
Correct. A dedication to my teeth and their care.
Here he comes now. He's the maestro. Yes,
And now, Preventive Dentistry in D sharp.